To get our anchor, I pinged the family office and the main guy coordinating multiple times. And each time it was a no. And I just had a really strong intuition. I'm like, I feel like they're going to come in, even though all the signs are just like, it's not going to work out. So I just kept emailing him updates. At some point, he was like, you know what? Maybe we will consider this. I was like, whoa, okay, game changer.
Welcome to Money Moves, the show about raising money, making great investments, and building venture scale businesses. I'm Neil Devani, your host and the founder of Necessary Ventures, a firm investing in what the world needs. Each week, we'll talk to folks who have raised anywhere from $10 million up to billions of dollars. We'll learn how they return multiples of 10x to 100x or more to their investors. We dive into their stories, uncovering what worked and what didn't, learning from real experiences to understand the journeys of raising capital and rapidly scaling a business. Money Moves isn't just for those already in the game. It's also for anyone interested in the mechanics of startups and venture capital. Whether you want to raise money, make better investments, or just understand how it all works, Money Moves gives you the insights and advice you need to succeed. So join us each week and hear from those who've been through it all and learn from their journeys. Ariana, thank you so much for joining me for an episode of Money Moves.
Thank you, Neil. I'm excited to be here.
I want to start by asking, how did you get into venture capital? How did you break into the industry?
So back in 2016, I just had this concept appear in my mind that I wanted to start a VC firm. And this was before I had a job in VC. I just became obsessive with the topic and started chatting with investors and learning as much as possible, purchased some textbooks, and then I was working with startups in various different types of agreements, like a profit share agreement with a startup, consulting startups, helped a professor spin out a company too. And I was just like, how do I do this at scale? And venture capital just seems so appealing, and also just the level of knowledge and learning. So I just cold applied to a few jobs and got a job in venture, and that's how it happened.
How did you get obsessed? Like, what made you interested in it in the first place?
I've thought about this question from a few different levels. So, like, my parents had a kids' clothing store when we were really little, and that company, it was a really small, like, boutique company, and that company failed when we were children. So on a psychological level, I'm like, whoa, am I trying to save my parents in some weird Freudian way by getting into venture capital and helping these like up and coming founders get their high risk companies off the ground? So there's that. And then I think ever since I was a kid, I've just always had a fascination with business and innovation and how the whole system of things get created. Like, it starts with a single person and an idea, and then it spreads into a whole organization, network of people creating products that add value. Like, that whole concept is just fascinating to me.
Yeah, you're a capitalist, but like a thoughtful one.
Oh, thanks. Okay, I'll take it.
So you worked at two other firms before starting your own, if I recall correctly. Did you know you wanted to start your own firm, or were you more like, yeah, let me just work at other firms and that came later?
Yeah, I literally in 2016, I just set that goal. I was like, I'm going to start my own firm. Even before I even really knew what the job was, it was just such a strong concept in my mind. And in my, I guess, delusional framework, it helped. It happened. So just set the goal and went for it and stayed focused on that for quite a few years. And, Conscience was born. And that was like a very exciting journey. Very, very hard. It was essentially bootstrapped. I spent less than $10,000 getting that off the ground. And I didn't really have an LP network. Like, I started with 5K, 10K check writers and snowballed from there. That was an intense ride getting that off the ground.
Was Conscious the first time you ever raised money?
So we did I call it a proof of concept fund, which was like this vehicle that housed 15 or so different companies in an SPV. A lot of the investors said that they've never seen a vehicle like this. And how that worked was I'd front a lot of my savings and get a company in and then get reimbursed from investors. And that ended up being around $870,000 for that vehicle and around 15 companies or so in a single LLC. So that was my first time raising money. And then I didn't really take a break right after that. That was nonstop fundraising and high level of risk, exchanging whatever's in my bank account for an investment and then getting reimbursed every time we got a check in. So that was like a very stressful 9-month period of my life. And then just went straight into fundraising and building Conscience, like literally right after that.
The tenacity and the confidence and courage to do that is incredible. Just risking your own capital over and over again. How did you find folks to pitch? How did you build your top of funnel?
It started with literally 5K, 10K check writers and friends making intros. It's just hustle. And I was cold emailing people, going to events, going to dinners, joining different programs. I joined Cool Water Capital. I did cohort 3 there. Winter's awesome.
Yeah, shout out to Winter.
Yeah, joined Bridge with Sophia, met other emerging managers, started going to those meetups and texting them. They made intros, I made intros. Like it's just this snowball process that everyone has to go through. And I think almost everyone experiences just a large volume of rejections, like often hundreds of rejections over a 12 to 24 month time span raising a fund, especially a first formal fund.
How many people do you think you pitched in total across that proof of concept fund and then the actual fund?
I actually added this on my CRM, which is just like a big giant spreadsheet. It was around 600 rejections, and then we had around 85 LPs that came in. So, around 700.
Yeah, that's like like 13% conversion rate? That's pretty good.
Oh, yeah. It started getting way better towards the end. I was just like, okay, I know what to say. I know who to pitch. We actually have some metrics. The deck's a lot nicer. So that was part of the 10,000 or so initial use of funds. I used $2,000 for a deck. I put down a $5,000 retainer for my fund formation lawyers, and most of the additional fees were postponed. I found another lawyer to just work for carried interest. So set up a profit share agreement, and then he handled all the other legal, and then paid for Anduin just to help manage like all the docs, because at some point it was just really tough to manage, especially with 85 people or different entities and individuals.
Again, it's like the word used earlier, hustle. Like that's just the definition of hustle. How did the pitch evolve? Like what was the pitch like in the very early days, and how did it change over time?
Oh man, every call was a learning lesson. It's like changed so much. I don't even remember it now. It's like I have to go back and look at all the versions of the deck. I think like we're definitely in like version double digits something. It changed so much because there was just so much rejection in the beginning, and every night I just felt worthless, and I was just reflecting. I'm like, wow, how do I actually make this work? And there weren't any signs of life for a while. And to get our anchor, I pinged him, it was a family office. I pinged the family office and the main guy coordinating multiple times, and each time it was a no. And I just had a really strong intuition. I'm like, I feel like they're going to come in, even though all the signs are just like, it's not going to work out. So I just kept emailing him updates, like almost weekly. It was pretty targeted updates. I'm like, I just feel it, like it's going to happen. And just kept scheduling calls, staying interested. And then at some point he was like, you know what, maybe we will consider this. I was like, whoa, okay, game changer. And then I just kept I sent more updates. And then at some point he's like, we can do a small check if you find an anchor. And I was like, okay, that's even better. And then I remember it was like a few days later, he was like, you know what, discussed it with the family, we're keen to potentially anchor. I was like, are you kidding me? But we have to meet you in person. So it was this whole story. It was a lot of that kind of serendipity as well, like throughout the process, and you just have no clue. And I think most of the time that strategy actually does not work. So like I've learned a lot about fundraising since then. Usually if you're not feeling the pull early on, it's probably going to stay a no. Like that's actually a really rare thing to have someone convert later on in the process after they've already said no. And after that, it's usually a no for all future rounds and funds as well.
What do you think made your worst pitches your worst pitches? Like what were the specific things about them?
So many things. I think I was just in such a hustle mode. Like I was getting like for the fun, not now. I can't, I don't know if I have it in me to do it now, but I was getting up at 4 a.m. every morning. I had my laptop next to me. I would just open my laptop and then work till I passed out. A lot of the LPs wanted to see more traction and data and pedigree and just more. They just wanted more, something different than what I could offer. So, and usually they know, I know in the first few minutes. So then it's just like, okay, well, how do we waste time or just politely get off this call? There were a lot of those types of calls, or calls where the other party didn't get it. There were a few, I call them fake family offices, where they pose as actual LPs, but they're not. Like they're either trying to start a fund or they're just gathering intel, or I don't know what their deal is. Yeah, I mean, there's a whole gamut. There's so many different awkward, upsetting, disappointing, sad. Yeah, the whole range of emotions.
Yeah, a lot of traps, a lot of blind ends in the maze. What about your best pitch or your best pitches? Like what made those the best?
I wish I still had this template, because I had a clear template where it was a consolidated list of all the learnings. And I'm like, okay, have the other person introduce themselves first. ask these certain key questions. Like the pitches that had more structure and collected all the insights and learnings for what worked specifically for me and my style and fund really helped. So that's why we started having, I think it was close to like 2/3 of the LPs converting towards the end. And it also helps to just have social proof. So, okay, so fast forward, end of the fundraise, have social proof, already have markups, already have a few companies in the portfolio, growth hacked LinkedIn, had a large, like around 80-person scout network, had all these technical advisors. So operationally, the fund was really stacked. And a lot of the feedback was, oh, your fund looks like it should be, $100 million plus fund because of all this like operational infrastructure. So presenting that, being far more polished, like just knowing how to speak to this audience made a really big difference. So just learning how to speak that language was also a learning curve. And also having other people in the industry endorse you really helps. Like none of the cold outbounds, maybe a couple of them worked, but for the most part did not. Warm intros and high quality warm intros are really important. So I think there's a whole sales process that happens even before the pitch happens, right? It's every single touch point. Who introduced you? How do you communicate in the email? And then the pitch, what's your immediate follow-up? It's all the things together. It's not just what happens on call.
Yeah, that's a really, really insightful share. I think that if you're going at it for the first time, whether for a company or for a fund, and you don't know that, you're cold emailing people, you're messaging them on LinkedIn, you're not thinking about power of the warm intro, and also the difference between a qualified warm intro from the right person versus just like someone who's making intros and is not qualified. There's a lot of range in there.
Yeah. And also, why are you different? Why you? Like having concise answers to these questions helped, and understanding the whole FAQs section for what's likely to show up in your pitch, because there were a lot of new questions that showed up in the very beginning. I didn't know how to answer a lot of those questions. So it was really rough during the pitch. Or maybe there's certain cues and topics and buzzwords that the investor would say during their intro, and I just didn't know what was signal versus noise. So I emphasized the wrong things in the pitch. Like there's so many ways a bad pitch can show up.
Are there things that you've learned post pitch, right? So you get a nice warm intro, you have a good first call, and someone wants some data, or they want to see a data room, or say, oh yeah, we're interested, follow up, but then they don't follow up and they are slow to respond. Like how do you manage post first pitch?
I do very detailed investor updates, and I do that frequently. So I create a mailing list, even if folks aren't that engaged, still include them on there. So, and then I have different tiers of that too. So folks that I felt it was like neutral to lukewarm to maybe not really there, it's a more generic investor update list. I'm like, okay, it's kind of, maybe this will convert, maybe not, probably not, whatever. It doesn't take me long to write these. And then there's another tier that's more custom and detailed. And then there's another tier that's just a lot more hands-on, like, can we meet in person for coffee? Do you want to walk through the data room together, et cetera? So it's really just designed based on gut feel from the interaction and stated signals like demonstrated interest. Usually if an investor is interested, they'll initiate the next step. There usually isn't so much ambiguity about it. And if you feel there's ambiguity, it's probably a no, but it's still worth having that continuous touch point as long as it's not overexerting.
I think that's a great point, and something that a lot of founders and investors just don't do, and then they're struggling to have engagement with people in their pipeline, but we're not sharing anything interesting with them. So
yeah, and it's also making it easy to read, being organized, being thoughtful, really listening to what they need. And it's not usually directly stated, it's from the questions they're asking, or you just get a sense of what the right materials to follow up with versus the entire kitchen sink of materials too. I mean, it's a sales process, right?
Yeah, absolutely. Let's talk about investing. So you've raised the fund, got the capital. How do you find companies to invest in, or how did you find companies to invest in?
When I was running Conscience and we're actively deploying, we had this 80-person scout network. I started just doing a lot of podcasts and content and speaking at events and going to events, just like really leaned into networking. And I had monthly and quarterly calls with several different managers. I remember we had that cadence going too. And I would build out a spreadsheet of different managers' interest areas and always make sure I had like a few opportunities that were relevant for them and high signal. For managers that weren't on these calls, I would have like an email cadence going. And usually there's a lot of reciprocity in our community. So that came back to serve us quite a bit. And what else would we do? I think those were the primary ways. I mean, after that, then it's just kind of random. We had a Airtable for company submissions. That wasn't so It was high volume, but not high yield. I don't think we took a single meeting from that, which, I was surprised by. I thought that that would actually be quite successful for us, but it didn't work out.
Yeah, we take cold pitches and we take cold inbound, and it's not been as good as I would have hoped. When you look back and you think about all of the companies that you met with, all the founders you met with, the pitches you took, what was the conversion rate roughly from that inbound message to a first meeting to diligence to actually investing?
That number became a lot more selective during the deployment cycle. I actually have this published on a LinkedIn post. I think we invested in 3 to 4 companies in 2024, like new companies, and we screened around 2,400 companies in thesis. So there was a much broader pipeline. 2,400 was in thesis from all these different sources. And then from there, we were pretty selective. I'm forgetting the step down, like what is that percentage conversion? But I think we were averaging, I'd say on the low end, 5 calls a week, on the high end, usually 20, maybe sometimes more a week. It was pretty variable. And usually diligence would take 2 to 3 weeks. Sometimes we anchored companies though, and sometimes we met founders pre-formation. So we would engage those founders for perhaps like 2 to 3 months before the entity was formed, and we'd help coordinate the round and help with the data room and the deck. So there was also in that process a lot of variability too.
What set apart the companies that you ended up investing in? Like what were the most important things you looked for? What did you index on?
Yeah, founder came first. The rest was like a far second and third. But we would also do a lot of technical due diligence too. We had about 15 different technical advisors in all the different domains that we would invest in. So after a first and second call, they would usually come in for like either a second and third call and help with the technical due diligence. Like we just want to make sure that the IP is sound, because the thesis was investing in science, empowering humanity, initially like consumer and science, but we've rebranded it during that journey. And it's really just that. And then from a human psychology standpoint, paid attention to velocity, paid attention to their ability to overcome the odds, just paid attention to a lot of different signals. I created this like 17-page due diligence document with all these different questions, and we did detailed post analysis on the entire portfolio across all these different parameters and characteristics. We're like, how do we codify this? Like, how do we turn this into something that looks more like software? And it was just challenging to do at the earliest stages. Like it's really just the DNA of the founder and their ability to get stuff done in the right area at the right time. But like, how do you know if something's so new? I'm curious, what would be your response to that question, and what's your prioritization?
Roughly the same, right? I usually talk about it as an arc where I used to just kind of try to apply critical thinking, like the scientific mind or the legal mind, and say, what are all the holes in this pitch and in this team, and look for those and try to invest in the companies that have the fewest holes. And that was like the very beginning of my venture career. And then I realized that's a terrible way to do it, because you invest in things that are plausibly good, but you're not looking for the asymmetric upside, and everything has holes. So then I started looking for, what are the things that if they work, they'll be the biggest outcome. And that kind of worked, but wasn't as good. And now it's sort of a custom framework or rubric for every opportunity, right? So depending on what the team wants to do, what they say they're capable of doing, we'll benchmark them against what we think they need to be able to do. So for a team that's building a care delivery company, it's going to look very different in terms of what skill sets we expect them to have versus a therapeutics team, or a team in climate that's using deep tech versus a climate team that's a business model innovation. And so it's more about like enzymatic fit, right? Like, is this the right key for the right lock? And if you unlock it, does it open a door that's actually valuable enough? Or are you opening a door to like a $50-100 million outcome? That's the kind of framework that we use.
Yeah, it's so company specific. I also remembered us spending a lot of time having a hypothesis driven approach. Like, what are the hypotheses? If true, this will be huge. What are the hypotheses? If true, it would fail. And then validating that. But it was so custom to the company after the founder piece. And then there's also this concept that, is this company making more and more sense or less and less sense the deeper you go down the rabbit hole? So that was often a sign. But I guess we'd miss companies where there's a lot of like misconception or misinformation, and then it ends up making a lot of sense after you get over that hurdle. So I'm sure like there's just flaws with every approach. Like every approach kind of has this trade-off, but having the strong founder just felt most reliable.
Yeah, I think that's the best thing you can do. And the second best thing is picking the right market. But wrong founder, right market doesn't work out. Right founder, wrong market, they may change markets. So you never know. What are some of the things that you saw founders do that you thought were very common mistakes or avoidable mistakes?
I would say not updating investors often enough, not managing their own psychology well, not managing the team's psychology well, like just not having that be part of their list of tasks or awareness in the company. I would say hiring too fast. They just raise funding and then they immediately go and hire this like really built out team, but there isn't a lot of thoughtfulness around the organizational design or the right pacing. Moving too slowly, like you do have to play the velocity game for most companies. That there's a lot of generic statements being made on this podcast just because it's hard to have like blanket generalizations, but
Give me
velocity,
some examples. Use examples.
I think at some point people just give up. They feel burnt out. They're like, is this even worth it? They get in their head about that, especially if they're not getting the validation from the investors and they're not getting the immediate validation from the market. Like you just have to keep iterating. And I think there's also a lack of awareness around what's normal, like what's a normal amount of chaos and friction, and not letting that get in your head. I mean, there's just so much that I guess like similar to investing, there's so many different examples. And
There's a million ways to mess up. Yeah. There's only a handful of ways to win.
oh, co-founder dynamics going sour. That's a tough one.
The iteration one you mentioned, I think, is great because you clearly iterated on your pitch, your raise, and I've seen that with so many founders. I think like settling for a local maxima versus trying to find true product market fit, or like iterating your way to the thing that's actually much stickier, much more differentiated or defensible, whatever it is not, I would say, a mistake, but a suboptimal approach that a lot of people end up with. And they're like, oh, well, we'll just kind of grind out the fundraise or the sales process or whatever it is. It's like, well, maybe you need to iterate on the product more, and then it'll make it a lot easier to raise money or to sell.
Yeah, and maybe the root of that, or one possible root of that, is overconfidence. And that's something I've seen too, like overconfidence in abilities to move fast in a fundraise. A lot of founders I engage, they're like, oh, it'll be a quick raise, we're awesome, it'll take a few months, and then it ends up taking 9, 10, 11, 12 months, and now they're like at 2 months of runway, and that's really stressful. Just stuff like that, like not having hubris in the process, and staying in humility and staying in constant learning and integration with what you're learning.
Yeah,
Yeah.
that's very wise and spiritually said. Uh,
Okay.
let's switch gears. Let's talk about MoldCo. So you made a very bold, brave choice to say, okay, did the VC thing. I have a company that I really believe in and I want to go pursue that. How did that happen? Take me back to the moment where you knew, okay, I have to do this.
It wasn't like a light bulb moment one day. I actually had a lot of resistance to starting this company. If I'm being honest, I felt like I had a good thing with conscience, and that was really difficult to get off the ground. The 0 to 1 in conscience was just like incredibly challenging. It was, I think, to date the hardest thing I've ever done. Just very, very hard to do. But this is MoldCo is the most personal and aligned company mission vision I've ever been a part of, and it started with a personal health issue. So during COVID, I was getting antsy. I was in LA, as you know, and I just felt really bored, and I just needed something a little bit more exciting than a lockdown. So I ended up moving to Miami along that part's cliche, but the apartment I was staying in, I was there for about 6.5 months, and I'm surprised I developed a chronic condition from mold in my home. So I take medication daily still from that mold exposure issue. And it started with mysterious symptoms such as very severe brain fog and fatigue, where I was just in bed most of the day. I remember some days just spending 15 hours in bed and not really having the energy to do much else. So I was just like off video, like reclined on the bed, like just trying to put whatever energy I had almost entirely into work. And just not feeling well. I remember having clumps of my hair coming out, rapid weight gain, not being able to exercise. And, before that, I was going to HIIT classes, doing boot camps. I was running stairs as a warm up. And then now I can't even walk up a flight or two of stairs without feeling winded. It was a very weird situation to have happen. And none of the doctors I went to, like immunologists or allergists, pulmonologists, neurologists, primary care physicians, knew what was going on. Most of the labs showed up normal. I think the biggest abnormality that stood out was low ferritin, but I wasn't anemic. So it was just strange and perplexing, and the lab work didn't represent the severity of the symptoms being experienced. It was just kind of a confusing period, like what's going on with my body? Am I okay? Do I even like what do I do with my life if this is my permanent state of being? Like all these existential questions that came up. And a friend tipped me off that this is what mold in your home looks like from a health perspective. I'm like, mold makes you this sick? Like I didn't even have that concept. So I hired a mold inspector and we found highly toxic levels of mold. It was around 35,000 spores per meter cubed. I think outside that day, because we did an outside control, was around 2,000 spores per meter cubed.
So your friend tipped you off. You did this test. You found all the mold in your home. What happened next?
After I made the mold health connection, which I was still skeptical of at the time, I just started learning. So I started reading and listening to podcasts. I read a lot of publications, so pulled literature, read a lot of articles, bought textbooks like the Surviving Mold textbook, went through that entire website, got in touch with these world experts and scientists, and just started learning. I had to science my way out of what was going on, and discovered a provider who can then offer a certain set of prescription medications, which proved out to be quite effective and safe for me. And I remember having this moment 2 weeks into treatment where I felt like I finally got my brain back and some of my energy levels back. And I remember collapsing on the floor and crying because it was so emotional, because I thought this was going to be my permanent state. And it felt awful and hopeless, and like I was out of control. And I even felt like I was being gaslit by medical professionals that this isn't real, even though there were tangible physical signs that it was real, like the rapid weight gain and the hair loss. So it was a very emotional time. And yeah, I mean, that was the origin story, and slowly started layering on just my own education and learning and meeting people in the space. And throughout this time, I wasn't going in with the thought or intention of starting a company. And then I started meeting more people with this issue, and then speaking to more people with this issue. And it turned out almost everyone I talked to, either they had an experience, their friend or family member had an experience. And I'm like, wait, that is an interesting signal. I'm like, how big is this market if that's true? And then I started sizing the market through multiple different lenses, looking at remediation, looking at common comorbidities and prevalence rates of that, and assigning different prevalence rates as mold as the root cause, looking into the literature of where like a fungal species was the cause of an illness, like just from the medical lens, from the water damage building lens, like remediator inspector lens, from CDC, EPA, like macro market lens, large housing study lens. There's a 12,000 housing study by Spangler where they looked at dampness and mold and started looking at how quickly mold grows in homes. So just started looking at this opportunity from all these different angles and perspectives. And it took me quite a long time to gain conviction. And then when I gained conviction, at this time I was still skeptical. I was like, I don't know if I want to stake my life on this. And so I was looking for a CEO.
I remember we talked about this. Yeah.
Yeah. Yeah. I had so much resistance to it. Like, it was just like, I was basically procrastinating this decision, trying to find, who else can run it. I can incubate it. I still want to do the fund. I still want to do fund two. And at that time, like, when I felt like my health issues got better, I was like, okay, now I can focus on fund two while still incubating this company. And then at some point, the timeline of the company build just kept extending and extending. I was like, well, I'm just going to keep building while I look for someone. And then at some point, it just made sense to me. I'm like, I think I'm going to have to run this company.
Did you raise money before that point, or was it after that point you decided to raise?
After, yeah. So we bootstrapped for the first year. It was like, I think we spent around $60,000 total for the first year.
Was that a harder raise or an easier raise than Fund One?
Oh my gosh, so much easier. That round closed. It was like 2x oversubscribed in like weeks. Like, it was a very easy raise.
What do you attribute that to?
Just network access. And I think a lot of the investors were just making a bet on me versus really fully seeing and understanding the opportunity. I feel like that's changed a lot in the more recent round, which hasn't been announced yet. But the early investors, where when there wasn't much there, like we were finalizing a pretty robust IP agreement, which took about a year to license in just so much IP exclusive to the company, like just basically sifted through all the literature and research and top minds. I'm like, okay, what's the highest signal intellectual property to bring into the company that makes sense for our commercialization strategy? So I was doing all this in stealth and building out the V0, which was just a very simple landing page with affiliate links, building out content, networking with folks, building out the thesis of what the business will be. So that was just like the first year on top of all the market research, and then comparing and contrasting every possible approach that we can find for treatment and understanding what the biomarkers would be. So there's this just intensive learning R&D phase for the first year of the company, and understanding like who should be on the team, what do we need from a team standpoint. So it was really interesting. It was a very artistic time because you're starting with a blank canvas, right? So you have to introduce constraints and definition and like form to what you're building, and there's just so many options. So there was this period of feeling like overwhelmed by the number of options, and how do we design the best strategy and structure and entry product, and who's the exact team member to do XYZ. Like there's just so many questions that are needing to be answered. But so I had to turn off the overwhelmed part of my brain and just keep putting one foot in front of the other and tackling what was just highest ROI at the time, as well as like planning a bit longer term with this IP agreement, which literally took about a year.
For everyone listening who may be having some of these symptoms themselves, or they know someone who is, what would you say to them, and how would you pitch what the company can offer?
Yeah, we offer a few different things. So we have our own Mold certified provider network. So we built a healthcare platform where you can see a specialist who's a medical professional. They'll assess you. There's an intake process. We offer prescription medications off label for this indication. And we also offer labs that are unique to mold illness, so high sensitivity for mold illness. We also have relationships with local inspectors and remediators in the states that we're live in. So that's Texas and Florida. We have a closed beta, and we've been onboarding patients this year through that closed beta program. And we also have a lot of content because there's quite a bit of misinformation online, especially in the Facebook groups, especially in the Reddit forums, and on so many of these websites. Like it is very challenging to get to truth. And after you get to truth, finding a provider that can actually prescribe these medications and give you the lab orders for the right things, that's another immense challenge. And then let's say you pass that, you finally find the person that can do that for you. They're often very expensive, tens of thousands of dollars. Yes, literally that expensive. And let's say you are financially capable, you found the person, you understand the right approach, you made the mold health connection. After that, there's often like a very long wait list to even see this provider. So just that whole chain of events is just so broken.
For someone who's not sure, what's the easiest way for them to figure out if they might have a mold problem? Is it like the home test? Is there some lab test?
Yeah, there's a few different options. So hiring a mold certified inspector is your best bet. You do want someone that can provoke the HVAC system and collect an air sample and use a thermal gun to check behind the walls and do a very detailed visual inspection, and not just see if there's visible mold there, but also look for the signs like warped paint and cracks, and there's like a strong, or it doesn't have to be strong, but an earthy, musty odor. You do want a professional checking for all these things, but a first great initial pass is something called the HERTSMI 2 test. So that's HERTSMI. It's also known as a dust test, and that's just a Swiffer pad. There's also a vacuum version too that tests for the top 5 mold species often found in water damaged building that can drive consequential health impacts. And there's also a 1,000 or roughly 1,000 data point study comparing the results of the HERTSMI test to the health outcomes of patients as well. So I like that there is some evidence there to actually ground your score into something a little bit more tangible, because it does come with a scoring system after you do the dust test, submit it for DNA PCR of the different species, which gets quantified, and you get a score of how prevalent these different species are. But that has some downsides as well, because you're getting a historic fingerprint of what happened in your home. And if it's not collected properly, like if you're swiping dust by the windows, for example, then you're collecting outside like microbial species, and that's not representative maybe of the air you're breathing. So there's just like little nuances like that. But every test has trade-offs, every approach has trade-offs, but those are two to start with.
Yeah, that's great. And one last question for you on this topic. If there's someone who's moved, from place to place, they're moving every year, like a young person, or for whatever reason their lifestyle requires them to move that often, and maybe they're not in a place where they're exposed now, but they have been for a long time chronically before. What advice would you give someone like that who maybe has a negative test in their home and the hertz test, but they're pretty confident they have exposure, risk of exposure previously?
Yeah, for that, we do have a lab panel available at access.moldco.com/labs. So we have discounted rates with LabCorp and we got it down to $99. And that includes three different analytes, MMP9, MSH, TGF beta 1. So the common way these three analytes show up is elevated MMP9, usually north of 332, low MSH, usually south of 32, and then high TGF beta 1, usually above 2200, but over 5000 is a better indicator. So that's the fingerprint of how that shows up. That's high sensitivity, not specificity, because those are markers of inflammation, but these are very common after a mold exposure event. So that coupled with the symptom clusters. So if you look up, biotoxin illness pathway symptom clusters, you'll see those different clusters. So having 8 or more of those also indicative. So it's a checklist, right? So verified mold in the environment, having dysregulated biomarkers, having the symptoms present. There's also something called a visual contrast sensitivity test. I haven't had much faith in that test being translated online well. It's done much better in person. Like I've had different results online versus in person. And that's due to like screen size differences and brightness and the ambient brightness, et cetera. Like you have to be in a room that's at least 70 Lamberts, which isn't even that bright. But there's just like, it's hard to translate this very in-person test to an online environment. So I guess don't fully rely on that unless your entire test looks like very dysregulated, then maybe it's that's a good sign. So all of that together, you just gain more and more confidence that your health issues can be attributed to mold. But we have an R&D component to what we're doing. So we have a several thousand sample biobank that we're analyzing and discovering new biomarkers. So hopefully we can have just like much more accurate ways of doing this. And there's also, transcriptomics testing coming out. Yeah, this is like a whole rabbit hole if we want to get into the urinary mycotoxin test and the antibody test. And
For a couple of minutes, I would love to actually. I was going to ask if you had, call it diagnostics is a very hard market, very hard to build that business. But let's just say you had like, a grant for whatever dollar amount you needed. Do you feel confident there's like a multi-omics or like some sort of biomarker?
That's
like
exactly what we're building. Yeah. And if we were to receive a grant, what I'd be most interested in near term is high throughput screening of more generic medications and peptides and compounds that are already commercially available today and FDA approved for positive phenotypic change and safety for this indication that currently isn't defined to go through the FDA. Like in that way, it is kind of like longevity where you have to, theoretically, if you were to go through the FDA for a new chemical entity or new compound, you would have to pick a different indication, like, an IBD, kind of like in aging, everyone's picking like IPF, right? So it would have to be hacked like that. But like, why even go on hard mode? Find compounds that are available today, prescribe that off label, pending it being safe and appropriate for the patient, et cetera.
Is the pathophysiology or is the treatment plan there about down regulating the immune response, or is it about affecting the infection in some way?
We're still understanding the pathophysiology of what's going on, but right now the current protocol pulls toxins from the body to reduce the toxic burden and reduce the cytokine storm that occurs from being exposed to the microbial soup in your water damaged building, right? You're inhaling the 20,000 breaths per day. Right now, the thesis is that it causes innate immune system dysregulation, which leads to chronic inflammation. There's TBD what the role of the adaptive immune system is. A lot of the researchers today think that there is none. Our team disagrees because we just haven't seen the data to support that. But a lot of the current thought is that there's an antigen presentation issue. There's certain like HLA haplotypes that are consistently causing issues for patients. Like 90% of the patients have like a certain genetic profile. But anyway, so microbial exposure, innate immune system dysregulation leading to a state of chronic inflammation, with the first step reducing the toxic burden to reduce the cytokine storm. There's also the second step, which is a biofilm disruptor for your nasal passage And the current hypothesis there is that there's this bacteria, Marcons, which is antibiotic resistant Staphylococcus bacteria, which resides in your nasal passages and releases something called hemolysins, which through some cascade of events, we don't know, lowers your MSH levels. And then your MSH is this master regulator in your body. And then the third step is this like anti-inflammatory peptide, vasointestinal polypeptide, which then rounds out the protocol. So we're calling that the iPhone 4. Like it's a great starting point. There's evidence to support it. There's published studies that have been peer reviewed. There's a lot to love. And we've seen pretty solid remission rates with that as well, but it's a starting point, right? Like this is an area of medicine and health that has been overlooked by academia, mainstream medicine, biotech, and pharma. So we have to be the pioneers in driving this research and understanding the next generation of treatments from there. That's why the entity of the company is not MoldCo, it's actually the MoldCo. And there's implications beyond mold. There's, tick-borne illness, there's long COVID, there's all sorts of microbial species that follow the same kind of storyline. And it'd be really interesting to figure out, okay, how do we better subtype these patients? How do we find the highest signal biomarkers? How do we design a low-cost, accessible platform to treat these patients? How do we have the medications available today for patients? How do we design something that's actually translatable globally, right? Like if you're having low-cost generic medications, and you'll have an easier time launching in other new markets and serving as much of the humanity as possible. So
that was exactly what I was going to ask about, right? It sounds so similar in terms of the diagnostic and treatment pathway for infectious diseases that lead to immune dysregulation, as well as allergens, dietary or otherwise. And we just don't have enough understanding of what's going on, but we can see a constellation of patterns and similar things across all of those that just have some sort of dysfunction as a result of the introduction of a foreign species.
Yeah, it feels like we're reading a lot of the same storylines across all these different,
But this is a rabbit hole for another time.
Yeah.
We have two segments to wrap things up. The first is what I call the asset allocation segment. So you were talking to a friend who's been an early employee at a successfully exited startup, or they're a founder who had an okay exit, or an investor who had a nice win. They have, call it like anywhere from $1 or $2 up to $10 million. And they're trying to figure out what to do in terms of investing that. And they want to keep working and building, but how should they allocate that? And in your opinion, and as a disclaimer, standard disclaimer, none of this is going to be considered financial, legal, or tax advice.
I mean, I would invest it in myself. Like I would build a company again or do something, right? Like be generative with that. I think just going all in on just that one thing, but being thoughtful before making that big of a decision, like doing the diligence and the research and customer discovery work and bootstrapping and testing, right? Like you may have like a few failed ideas before you find the right one, and then just going all in once you find the right one. So just betting on yourself with 100% of that.
I love it. I love it. No one has said that yet. So
really? Whoa.
Yeah. Some of the other guests are a little older, a little more conservative, but
okay.
I love it. Okay, last segment here, our lightning round to wrap things up. One fun question and then some more serious ones. What food would you eat if you can only have one food for the rest of your life?
This is such a bad answer because I'm running a healthcare company, but mochi.
Any particular flavor?
Green tea.
Okay, all right. It's a classic.
Green tea, yeah.
You can't go wrong with that. Okay, next question. What is the hardest lesson you've had to learn in your career?
Patience. Having like a chill mode, I guess, just like waiting for things to play out or just observing and not taking action, right? Like this more passive way of being. I have a tough time doing that, but there's so many circumstances where that is the right decision to do nothing, right? Like to just don't do anything, just sit, watch, inaction versus action, right? Like it ties into this whole patience concept. Even patience with myself, because I'm really hard on myself. I'm like, why aren't I moving faster? Why can't I absorb this information faster? Like I just always want to be in tomorrow versus today. So that creates strife in my mind. So that's been probably one of the most challenging things for me.
Yeah. I appreciate that. That's a great answer. What has been the best moment of your business life so far?
I think having the team that we have, it just feels like a cool family. I feel like, I don't know, I just feel like really seen. I feel like we're just doing really great things to make the world a better place, and that's just incredibly rewarding. Like I'm excited to work with them and interact with them. I'm humbled by them. So yeah, it's just cool to be working with some of the most talented, intelligent, hardworking, high integrity people. It's been great.
I think a lot of mission-driven founders feel that way and probably don't have a safe space or the courage to just say, yeah, I feel seen. And that's a huge benefit to building this team, building this company, because you yourself have a very deep conviction and belief in what you're doing, and being surrounded by people who share that conviction and share that belief. And not just that, but share it with you as the leader of the mission, I think is incredibly validating.
Yeah, especially because in the beginning phases, I didn't really have a lot of believers or support or endorsement for doing this. Like most people are like, why don't you just do the venture thing that's working? I even had like some friends, it felt like an intervention, but it wasn't. But it basically was, don't do this, just keep building the fund. But I'm so glad I tuned out that and just listened to what I felt was right, which is this. Yeah.
Yeah. Awesome. Okay, last question for you here. Who's helped you the most in your career?
I think Shirley Mao in building the product for MoldCo, Ben Gallagher, Cannonball Capital for anchoring Conscience. There have just been so much support, so many people. I mean, this is like a very big list for me, but those two names really stand out at the moment.
Well, thanks to them, and thanks to you for joining for an episode of Money Moves.
Thank you, Neil. This is fun.
Thanks again for tuning in to this episode of Money Moves. If you learned something new or just loved this episode, click below to subscribe. See you next week.